Hello, this is Dr. Randy McCracken again. I'm Doctor of Chiropractic, author and creator of Back to Health Naturally, and yes, that's my real name. For today's video topic, I'd like to talk to you about lower back pain with thigh or groin pain. Now, this condition can be frequently misdiagnosed as sciatica, which is nerve irritation, the biggest nerve in your body, which typically causes pain, numbness, or tingling to run down from the lower back into the leg, foot, or ankle. The problem we're talking about today, however, is caused by joint irritation. By performing specialized joint tests, I can localize the problem to the lower back, and it can be confirmed with standard x-rays. Now notice I said standard x-rays, not an MRI. I continue to see more and more patients with these costly procedures, and it's not necessary. All it does is continue to drive up your healthcare cost. Now 4 lower back x-rays in a standing position will clearly reveal your problem. Now since nothing is broken, the cause is often overlooked, and your typical treatment generally consists of physical therapy and pain relievers. You only receive temporary relief, however. Why? Because the real cause has not been treated. So let's look at your actual x-rays of one of my actual patients. So this is how you see the facets. It's called an oblique view, which is basically a 45-degree angle of your lower back, halfway between a front and side view, or at 45 degrees. And basically you see the 5 lower back bones, and then we see the facets, the top one and the bottom one. If we enlarge this, we can get a better view and see what we're talking about in particular. So that when we move down here, if you notice here, there's a nice opening. Facet, this facet right here is being jammed into the base of the one above. 9 times out of 10, an x-ray report will say there's nothing wrong, because basically nothing is broken and there's no disease process. We just have this being jammed in there, so it's a mechanical joint problem, technically called facet syndrome. So here we have a plastic model of your spine, and as we talked about, the problem is a pinching effect that typically occurs similar to this. And what the treatment does, basically, we just gently stretch these 2 joints open to restore a normal position. Now these joints are under a lot of pressure. They carry 10 times the pressure that your knees do when you're in a standing position. A point of confusion typically occurs because the medical report reads normal, because nothing is broken. However, you clearly saw the problem on the x-ray. So chiropractors look at your x-rays from a structural engineering standpoint. Your joints aren't where they should be. And this problem is called facet syndrome. And I liken it to a pair of vice grips being applied to the joints in your lower back. What do? You must see a doctor of chiropractic who's undergone further training, education in the use of the Cox distraction procedure. Now with the Cox table and treatment, I am able to open the joint, or what I call removing your finger between the 2 doors, by bending the joint slowly forwards and backwards and side to side. This restores normal position for your joints. It also lubricates your joints and centers the jelly-like ball bearing in the center of the disc. It also restores normal motion. This procedure has allowed me to succeed when surgery was recommended and other methods have failed, even standard chiropractic adjustments. So I have successfully treated facet syndrome, ruptured disc, lower back and leg pain, to scoliosis. Now this procedure should not be confused with axial decompression therapy, in which no spinal adjustment is given, only traction. It is considered experimental, it's not covered by insurance, and they typically ask that you be seen 20 times in a month for cash. So if you're interested, I'd be more than happy to send you a free report on the Cox treatment, but you must contact me today at drmc@windstream.net. So this is Dr. Randy McCracken saying goodbye until we meet again. Live longer, healthier, and happier with chiropractic.